Good evening. I'm Michelle Leifer. I'm the director of the Usdan Institute for Animal Health Education at the Schwarzman Animal Medical Center in New York City. Along with my colleague, Kimberly Young, I'd like to welcome everyone to tonight's event, Stress and Anxiety in Pets. We are thrilled to partner once again with Cornell University for this event, and I'd like to thank Melanie Cordova, Heather Hughes, and Kristen Engel-Ross from Cornell for helping to coordinate. We'll be taking questions via chat, and the doctors will answer the questions at the end of the presentation, and we'll get to as many as possible. I'd like to take a quick moment to just let everyone know about an upcoming online event, Heart Disease in Pets as They Age, with board-certified cardiologist, Dr. Samantha Kochi from AMC's Cardiology Service. That will be held on Wednesday, May 24th at 6 p.m. You can register for that event on our website, which is amcny.org/events. And you'll also find the link to register in our weekly newsletter that goes out this evening. It's now my pleasure to introduce tonight's speakers. Dr. Kate Anderson graduated from Cornell's vet school in 2008. She's currently an assistant clinical professor in the Department of Clinical Sciences at the Duffield Institute for Animal Behavior at Cornell University's College of Veterinary Medicine. Dr. Anderson is also a fear-free certified professional. She lives in Ithaca with her husband and their dog, Ernie. Dr. Pamela Perry earned her veterinary degree and PhD from Cornell. Her graduate research evaluated the effects of enrichment on the behavior, welfare, adoptability, and retention of shelter dogs. She has lectured extensively on animal behavior and welfare topics and is currently a senior veterinary behavior resident at Cornell University Hospital for Animals and a behavior consultant for the Cornell Feline Health Center's Community Consultation Service. Thank you both for making time to lead tonight's event. Please welcome Dr. Kate Anderson and Dr. Pamela Perry.
Hi, everyone. All right, am I okay to share? Okay, how's that? We made it. Yay.
So tonight, we are going to discuss a topic that we could spend weeks discussing, but hopefully we will highlight some important points that you can take home and hopefully be useful for you and some of your animals. Specifically, we want to discuss fear, anxiety, and stress and related emotions in dogs and cats, what they are, why and how do they occur, and how do we recognize these in our animals so that we can prevent or treat these emotions when they do occur. So starting out with some nice definitions, fear, which is kind of an obvious one, is a physiological and behavioral response to a perceived danger. And it is adaptive in that it allows the animal to avoid dangerous situations, such as little kittens running around on the floor. Anxiety, on the other hand, is a feeling of apprehension in anticipation of something potentially harmful. So it's something that the animal believes predicts a negative outcome. A dog may become anxious when riding in the car because he's learned that car rides lead to trips to the veterinary clinic. And therefore, because he doesn't like going to the veterinary clinic, he becomes anxious while traveling. Phobias are more of a concern because they are a maladaptive response of persistent fear and anxiety that is out of proportion to the actual threat. A phobia is considered to be abnormal because it interferes with the animal's ability to function normally. When lightning strikes a tree nearby, the fear response of increased heart rate, trying to escape, so on, is normal because it allows you to remove yourself from a dangerous situation. However, when a dog becomes extremely anxious and tries to escape, when the clouds roll in or the winds pick up, that is considered abnormal. And unfortunately, we do see a fair number of dogs who have phobias towards noises and thunderstorms. Stress, on the other hand, is more of a term that encompasses fear and anxiety, because it describes a situation that exceeds the animal's ability to cope with the situation. So it's a situation that overtaxes their control system. And so an animal that is undergoing fear and anxiety, that result is what we call stress. And some people will talk about good stress or toxic stress, but for this presentation, stress is what we're referring to as something that's overtaxing that animal's coping ability. And when it's chronic, it can lead to physiological or health problems such as disease, as well as behavioral problems. And as I mentioned, fear is an adaptive response that allows an animal to avoid danger. However, repeated states of fear and anxiety can lead, repeated states of fear can lead to anxiety, and that eventually can lead to a potential phobia. So what starts out as adaptive can progress to a maladaptive response. And this slide illustrates the fear spectrum from sensitivity, such as being startled by your alarm clock in the morning, to fear of a predator. And from that to anxiety when a dog, for example, is being left home alone, to thunderstorm phobia. So in terms of what causes fear, anxiety, and stress in animals, several things can do it. For some, loud, sudden noises or sudden movements. And I certainly experienced this with one of my kitties, who will run and hide if I walk through a room too quickly or move my arm suddenly. Some dogs and cats are fearful of unfamiliar people or other animals. And certainly a change in environment, being in a new environment, can be stressful to animals. Changes in routine also can be stressful. And this was highlighted during the pandemic, when at the beginning there was a change in routine when everybody was suddenly working from home, which most animals enjoyed, not all, but most. And then as the pandemic restrictions were lifted, people started going back to work. So again, the routines were changed, and now the animals are being left home alone more often. So again, being left alone or isolated is a stressor. Also, unfortunately, going to the veterinary clinic is a stressor for a lot of animals, and which, we go into this profession because we love animals, but then we learn very quickly they don't always love us.
Okay, so that slide is my cue for my turn to talk a little bit about this topic, a little bit more about what's going on in the brain and the body. So as Dr. Perry discussed, some fear and anxiety in response to stress is normal and necessary for survival, but why do some animals develop more repeated or chronic fears or phobias? Or why are some animals just more anxious in general? And the answer to that is not always straightforward. The development of behavior is rarely due to one single event. It's complex, and it's due to the interplay of many factors: genetics, the brain, hormones, learning, the animal's specific temperament or personality, and then the environment or the context in which they find themselves. And there's much, much more that goes into it. Some behaviors might be passed down genetically, and some might be due to physical changes during an animal's development, even before they're born. There have been studies that have shown that cortisol, increased cortisol in a pregnant dog can actually be passed on to the puppies. And there's also the phenomenon of sort of biological preparedness. So as Dr. Perry mentioned, we have we as humans and also animals have an innate fear of things that might be harmful. such as predators. And it's thought that biological preparedness may play a role in how people develop fears and phobias. And I think the same may likely be true for animals. So it's kind of like something that is meant to protect us kind of becomes excessive. When it comes to environment or context, this could include early life experiences, traumatic events, or specifically lack of experience of something. And through learning, some animals can habituate and get used to certain things in their environment, while other experiences, either good or bad, will affect how they act in the future. So fear can activate significant chemical changes in the body, and we might see what is commonly referred to as a fight or flight response. You're probably familiar with that with people. For animals, most species, especially cats and dogs, flight entails trying to escape or avoid the perceived threat. Fight is a more defensive posture, defensive aggression, and this might happen when an animal feels they have no other choice or no ability to escape the fearful stimuli. And then other responses beyond fight or flight are freeze, which is a sign of sort of anxious anticipation where an animal might hope to avoid harm. And fidgeting, you might think of that a little less intense than fight or flight, but it still does show us that there's some anxiety at play. And that's when an animal performs a behavior that's sort of out of context to the situation. For people, that might be like, tapping their foot if they're nervous about something or something's not happening in a way they expect, or twirling their hair. And animals might fidget if they're just unable to avoid the situation altogether. One thing I encounter a lot is the common observation or frustration that when an animal doesn't respond to us in the way we expect, we get a little frustrated. We think maybe they're just not listening, they have selective hearing, they're being spiteful. My dog knows how to sit, I've taught him how to sit, and he suddenly just ignored me. Or I came home and my cat had peed on the bed, and that's never happened before. My cat must be mad at me. And it's important to realize that cat and dog brains, although cats and dogs are very different, but in general, they don't really think that way. And that when they're having a highly arousing experience, so animals can have logical thought, but when they're having a highly arousing experience, or they're frightened, or chronically stressed, it kind of overrides the thinking or logical side of the brain. And that can happen with people too. So it makes it hard for your pet to think before they act when they're in a fearful state or an anxious state. What's frustrating is that while they aren't able to take in new information, it only takes one of those highly emotional experiences for them to form a memory of that. So one distressing event can have a marked effect on their future behavior, even if we didn't intend that to happen. And in that moment, when they're really anxious, we may be tempted to try to direct them to a different behavior, maybe, out of concern to decrease their fear, but their brain is really primed to acknowledge that threat, and it's not as effective as we would hope it would be. So it's a little bit difficult. Another thing that can happen is that dogs, like humans and rodents, they kind of reach social maturity, which is kind of like the teenage years, when they're young, and that kind of coincides with changes in the brain, that there's a balancing act going on between their emotional brain and their rational brains. And sometimes the emotional brain wins out a little more. We all know that, a teenage person is very different from a 40-year-old or, an adult in general, and how they behave or respond to things, and dogs aren't entirely different. So if you remember nothing else, I think it's really important to know that only one negative experience can condition a fear response, and strong emotions affect logical thinking or learning. So it's really difficult to change your pet's behavior in the moment they're stressed. So certainly things we could do to help them in that moment. But I like one of the phrases I've seen passed around online, which is to prepare your dog or cat for the moment, not in the moment. So it's hard sometimes for them to actually change in that moment of fear. I think it's important also to realize that any change in your pet's behavior is an indication for a physical exam by a veterinarian. For example, some of the signs of separation anxiety could be urinating in the house, and this could actually be due to an underlying medical issue. And we could be convinced that it's due to anxiety, and we're totally sure that's what's going on. But if we don't actually rule out that there could be an infection in the bladder or some other physical problem, it's going to be very frustrating to try to treat that behavioral problem. And as animals age, diseases of the sensory system, their internal organs, nervous system can all affect their experience in the world, and that can contribute to a change in their behavior. I'll also talk about how pain and discomfort can lead to behavior consistent with anxiety. And that kind of leads me to the question that comes up a lot, like, is it medical or is it behavioral? And I think we're really, over the years, finding that the answer is often both. We know that dogs in pain are more likely to have a phobia to a noise. And that makes a lot of sense. If you just think about people, I certainly see clients all the time who maybe are frustrated with very loud barking by their dog. And certainly if there's someone in the home that has back pain or some other chronic painful condition, that person is going to be far more bothered by the barking than anyone else in the house. And so it makes sense that that would be true for dogs and cats as well. It's also important to realize that anxiety usually gets worse with age. We tend to think, especially when it's a young puppy, oh, they'll grow out of it, just give them time. They just need to get used to things. Unfortunately, a lot of research shows that they're much more likely to grow into the problem, not out of it. So addressing it early is always best. And a lot of times we don't have the luxury of treating one thing and then the other. So more and more, we're finding that if we address pain and behavioral problems at the same time, we have the best possible outcome.
And that is my cue to join back in. So what are some signs of fear and anxiety in cats? A fearful cat who's truly fearful is pretty obvious to identify. And I will give a disclaimer here. I have 5 cats. I fed them all right before we started, but it does not mean they're all going to behave, as I hear one coming to join me. So this is Goes. He is featured in a couple slides. And anyway, so dilated pupils. When a cat is aroused or frightened, their pupils tend to get quite big. And cats have very large eyes, and their pupils can really dilate. Other signs include the ears turning out or back, and especially if they're flattened to the head, which is extreme fear. And cats also tend to have a lowered body posture and may wrap their tail around their body when they are frightened or stressed or not feeling well in general. The Halloween posture in the lower left picture is actually a sign of fear or defensiveness. And especially when they piloerect or raise their hair, they puff out. And what they're trying to do is make themselves look bigger to the potential threat or whatever it is that is scaring them. And certainly vocalizations can occur in cats. Usually when a cat is frightened, is being threatened by another individual, they make a lot of noise. They may growl, hiss, or spit. And when dealing with cats who are fighting in a home, if the owners are unsure who is actually the instigator and who's the victim, I try to ascertain who is making the most noise, because the one making the most noise is probably the most fearful one, and they're probably the victim. These are two posters just depicting cartoon drawings of cat body postures and interpretations of them. So again, the poster on the left is just reiterating some of the facial expressions that we see in kitties. Cats also may hide, lie on their side, flick their tails, or twitch it. They tend to have a lower body posture, or the Halloween cat posture. And they also, when a cat is stressed, especially if something suddenly startles them, they may run off, sit down, turn around, and start grooming themselves quickly and suddenly. And that can be kind of a means of kind of shaking it off, so to speak. It's like, oh, something just scared me. And so they turn around and start grooming themselves. So in terms of behavioral responses to stress, cats can be very unique in their ways of telling us that something's not right. And as Dr. Anderson said, they're not trying to be spiteful or get back at us. Cats who start eliminating outside the litter box may in fact be stressed. So if you go away for a weekend, come back to find the cat has urinated on the bed, it wasn't because the cat was mad at you or was trying to get back at you for leaving them. The cat very well probably experienced some stress while you were gone, and this is their way of communicating it. They also can start showing aggression towards other cats in the home or towards the owners or other pets. And owners also may know a decrease in grooming behavior or play behavior. Play behavior is one that is a good indicator of when a cat feels really comfortable in their environment. If they don't feel secure, they're not going to let their guard down enough to perform any playful behavior. So when you see a cat playing, you know that they're comfortable, they're having a good time, they're not worried about potential threats. When a cat is frightened or stressed, then they often try to escape, and cats are really good at hiding, usually under the bed, but in closets or any small nook or cranny they can find. One client reported their cat found a very small hole in the wall behind the television console they did not know was there, and basically would hide within the wall itself until the owner realized where the cat was hiding. Cats also may show vomiting or diarrhea or a change in appetite, usually increased, but sometimes, or excuse me, usually decreased, but sometimes it can be increased in some cats. And even though decreased grooming can be a sign of stress, repetitive behavior or over grooming can also be a sign of stress in cats. And this slide just listing some of the more common anxiety and fear disorders that we treat in cats. And I should note that most of the behavior problems we see in pets are related to fear and anxiety. So the more we can address the underlying fear and anxiety, the better we are at treating the behavior problem. Again, elimination issues, urinating, defecating outside the box, as well as urine marking, is often due to anxiety. Aggression towards cats, humans, or other pets. Fear of people and pets is common. Cats they live in a land of giants. You know, we tower over them, and some of them are very frightened by people. Loud, sudden noises can frighten them and can be problematic if it's to more common noises around the house. And although it's not recognized as much as in dogs, some cats do develop signs of separation anxiety when separated from their owners. And what we call situational fears or anxieties are common in cats, and those include such situations such as traveling or going to the veterinary clinic. In terms of how do we prevent or treat these, in general, some of the key areas are providing consistency and predictability. So keeping a routine that the cat can expect. They like to know what's going to happen, when it's going to happen. It gives them a sense of control. So a very consistent routine is helpful. And although we can't keep things at the exact same time every day, if you keep the order of events the same, that kind of overrides some of the changes in time. So for instance, if you schedule playtime with your cat after dinner every evening, then the cat learns that once you finish dinner, clear the table, hopefully do the dishes, then they get to have one-on-one time with you. So it doesn't matter if dinner is at 6 p.m. or 8 p.m. It's that sequence of events leading up to it that they can expect when their interaction time is. That said, contrary to what a lot of people think, cats do enjoy spending time with their owners. So it's important to schedule that with them. But each cat has a different preference for the type of interaction. Some cats enjoy lap time. Some cats enjoy playtime. Some cats just want to be near you, not necessarily directly interacting with you. Cats also need time to themselves, and certainly they need places where they can go and hide when they're feeling overwhelmed or just need a break from everything. So providing some safe places, hiding areas are really, really important. I knew this would happen. when you have multiple cats in a home, I advise clients to determine the number of social groups you have. So by a social group, I mean, which are the cats who spend time together, that groom each other, that play together, that sleep together. Those are the cats that form a social group. I have 5 cats. I have 2 social groups. So for each social group, you need to provide separate key resources, such as food and water stations, litter boxes, resting areas, window perches, and so on, so that they can access those resources without needing to encounter each other. And this can reduce conflict within the home and certainly reduce stress. And studies have shown that cats who in a home who are living with multiple cats, if one of the cats is urine spraying around the house, not only is their cortisol levels higher, meaning they have a higher level of stress, but the entire household has a higher level of stress. So trying to minimize it between every cat can really pay off. And enrichment's another good area to address in terms of trying to lower stress and anxiety and giving cats an appropriate outlet for their normal behaviors. So providing window perches where they can watch birds, playing cat videos, whether it's watching videos of birds or wildlife. One of my kitties likes to watch golf, so she can watch the ball go across the screen, giving them vertical space so that they can get up high and kind of explore up there, or they often go, a lot of cats like to get up high to get away from anything that frightens them, and providing appropriate toys for playing. Cats are very playful creatures, and as well as dogs, and we have selected for cats that maintain that type of juvenile behavior into adulthood. So toys that mimic prey, such as fake mice or feather toys that look like birds that flutter, flounce, and move erratically, can really entice a cat into play. It's also important to monitor your cat's behavior. And if you think there might be a problem arising, keep a journal of it so you can identify any patterns to it. And that really can help not only with diagnosing and assessing the problem, but also assessing any progress once you start treating it. And if you see any changes in behavior that are concerning, certainly seek professional help, starting with your regular veterinarian. So just briefly, I want to talk specifically about travel anxiety, because this is a very common problem in cats. As veterinarians, we want you to bring your kitties to us for care, but when it's so traumatic for everyone involved to get the cat to the clinic and then the whole experience at the clinic, then it's less likely that owners are wanting to bring their cats to us. So if we can get the cat, first of all, to at least tolerate, if not enjoy the carrier, then that can help with the whole overall process. Because for the cat, the carrier is the evil thing that only takes them to the vet clinic. So purchase a carrier that's easy to open. I prefer the soft-sided ones that zip on the top as well as in the front or sides, and put it in a room where the cat commonly stays so that they can explore it on their own. They can sleep in it, put some nice soft bedding in there, throw some toys and treats or catnip in there, encourage the cat to use the carrier at times other than when you need to travel. And if the cat's comfortable in the carrier, then it makes the whole process of getting them in the car and then to wherever you're going a lot easier. You can also spray or wipe feline facial pheromones on the inside of the carrier to make it more enticing. And on the day of travel, try to entice them in with food or a toy, zip up the openings, and then cover it with a towel so they don't have to see all the scary things on the way out to the car and then during travel that might frighten them. And secure the carrier in the car with a seat belt or harness, or place it on the floor behind the front seat so that it's safe when you're traveling. And because cats usually only go in the car to the vet clinic, it really may help to do some joy rides with your kitties. And this is Goose, who was just in my lap. He absolutely loves car rides, a little bit more than what would be expected of a normal cat. And part of the reason is we started when he was a kitten, going monthly trips to Vermont, but also his trips aren't to the clinic. They're usually to go visit my family. And along the way in summer months, we stop and get ice cream. And I realized very quickly that Goose enjoys a good ice cream cone with me. So taking your cats either to get ice cream or to a park, walking them on a leash and harness, anything that's fun and enjoyable will help them associate the traveling with a pleasurable outcome rather than just going to the vet clinic where they're already frightened and scared.
Had trouble unmuting. Okay. Can everyone hear me? Okay, that's my cue. I'm going to talk a little bit about recognizing fear and anxiety in dogs. And after the fact, I realized one thing I commonly forget is to include pictures of normal dogs in the body language discussion, because I think sometimes it's important to have that contrast. So I'll describe it a little bit, but hopefully, but not always, it's fairly straightforward to recognize fear and anxiety in your dog when it's extreme. But what I have found is that very subtle signs are poorly understood by most people and easy to miss. Also, if your dog tends to be anxious, more often than not, you might think that those behaviors are normal for them, that, there really isn't a concern because you're seeing it so often. Obviously, if your dog's behavior changes, though, it's important to think about why that might be and what's going on. So whenever you see a change in your dog's behavior and recognize that they might be fearful or anxious, I encourage people to think about what's happening at that moment, who's present, what are they doing, where are you? Often I find that what we perceive as a very benign or non-threatening interaction is very different from our dog's point of view. So I often get told, like, our dog growled at somebody and they weren't doing anything, but then it turns out they were reaching for petting a dog. And that actually can be scary and threatening for many dogs, even though we think that's normal and things that we typically would do. Most dogs actually do, it's one thing that kind of breaks my heart. They don't like hugs and kisses. They may tolerate it from familiar people, but they don't really enjoy that kind of interaction. Of course, there are dogs out there who absolutely love it and will lean into people and really love that interaction too. Every dog is different. But it's important to be honest with yourself and look at what your dog is doing in that moment and how they're interacting. Another thing to look at is what they're actually doing. Are they looking away? Are they moving away? Are they refusing treats when normally they would inhale treats with no questions asked? That's a huge sign that your dog is very stressed, because stress can depress appetite in that moment. Their body language too. Look at their eyes, their ears, their body position, their tail, and I'll show you some pictures of that. Are they crouching? Is their tail really high up or is it tucked? Normal should be loose and about 90 degrees to their body. Like cats, they can also have dilated pupils. Extreme fear and anxiety includes salivating, urinating or defecating, vomiting, or having diarrhea. I just want to talk a little bit about this picture here. I took this at a picture at a museum that I was at. And it's hard once you start looking at dog body language, you can't help but see it everywhere, or notice things everywhere you go. And obviously this is a drawing and it's just a little snapshot in time. So it's perfectly possible that this pup is really enjoying interacting with this child. But what I see immediately is a dog whose ears are back, they're showing the whites of their eyes, and he's kind of awkwardly placed on that stool. So it's hard to tell if he's actually kind of trying to lean back and get away. He doesn't have a tail for us to know whether it would be tucked or not. But, I think it's so hard sometimes, from a picture, sure, you could get the wrong interpretation, but a lot of times pictures that people post of their dogs and think are very cute, actually, to me, I'm like, oh, I don't think that dog is really enjoying himself in that moment. So here are some examples that I think are really important. The top left, the little doggy that's lying with her belly showing, that's one of the most common misconceptions that I see. Usually, there's certainly dogs who love belly rubs and will present their belly. There's no question about that. But I do commonly see people that have been bitten by a dog when they went to reach to pet its belly. And that's because often this posture is a way of a dog telling you, please leave me alone. I don't really want to interact with you. Sometimes they will stiffen and growl, and then it's a little more obvious. But I always think that unless you know a dog really well, and there's other body signals going on that tell you how that dog is feeling, if a dog shows you their belly, just give them space. The dogs on the right have some of the more subtle signs that you might see. So licking their lips. And of course, sometimes dogs lick their lips because there's treats or something they're interested in, but so you have to look at the whole picture. But licking their lips, yawning, kind of looking to the side, we call that showing the whites of the eyes or whale-eyed. Those are all sort of subtle signs that a dog may be uncomfortable in a certain situation. And then the dog on the lower left, the black and white Dalmatian type dog, I think that one's pretty clear to most people that dog is saying, just please leave me alone. I really don't want to interact with you. The dog is growling and showing his teeth, and he's kind of got a hard stare, and he's, looks like he's in a pretty tense posture, but probably also starting to like inch back, because dogs tend to be a little, when they're scared, they kind of want to look scary, but then they move back a little bit too. For normal body language, it's generally very loose, like wiggly, noodly. Like I said, the tail is at 90 degrees to the body, and the mouth is kind of, loose and relaxed, and you don't see all of these things going on. So as with cats, there are many wonderful cartoon resources available for adults and children to learn about dog body language. You can get these posters online. There's some websites that have interactive modules about dogs, and we can share some of those. There's a lot of videos too that are really helpful. I think someone made a video of the poster on the left going through that in detail. So these are all, really helpful tools out there, and really important, especially to teach children. So a lot of the things that we treat in dogs are very similar to cats. And obviously, some dogs may have transient fear or anxiety over something in their life, and it doesn't necessarily mean they have an emotional disorder, but sometimes it can affect their ability to function and their quality of life and their owner's quality of life, and that's often when people come to us for treatment. So it can range from everything to isolated specific triggers, like very severe noise and storm phobia, situational anxiety, to household noises, the vacuum, travel anxiety, lots of other situations. Generalized anxiety is when we see it more consistently on a daily basis to multiple different triggers, and that can be very difficult for dogs to live with. Aggression is a common presentation, and fear and anxiety are usually the most likely underlying emotions. Aggression itself is not an emotion. Aggression is actually a behavioral strategy based on a strong emotion. For people, when we think of aggression, we usually think of anger. We can be aggressive when we're fearful, ashamed too, and that's hard because people have to kind of articulate that. I don't generally feel like the behavior that I see in dogs is out of anger. I usually feel that it's either fear, anxiety, and probably frustration in many cases too, which is a whole different topic. Urinary accidents is sort of a general term. We don't, that can be coinciding with fear and anxiety in general. But I mention it because sometimes we do see that as sort of one of the only symptoms. For example, dogs that urinate when a new person arrives to the house, or they're very excited. And sometimes we might just think, oh, that's just them. They have a weak bladder or something like that. But actually that can mean that they're having a pretty significant fear response. And then, of course, dogs that have separation-related disorders can also urinate or defecate in the house. These days, it's pretty easy to put a camera in the house and see what they're doing. So we might see howling, drooling, pacing, destructive behavior, scratches around the door, chewing at the molding, trying to escape, breaking out of crates is also pretty common. So those are pretty debilitating disorders and definitely warrant treatment. It's also important to make sure that dogs with separation anxiety don't also have noise phobia, because that's a very common finding, is that dogs with separation anxiety are overrepresented for noise phobia. So we always try to rule that out as well. Clicking. There we go. So picking up on what I was talking about earlier about sort of the development of behaviors, I wanted to talk a little bit about some risk factors. And, it's hard because there isn't ever one moment necessarily where we might see a behavior develop. It's an interplay between biology, genetics, environment, and learning. But certain life events can put dogs at risk for emotional disorders. So developmentally, it's important to be aware of that. So you can try to sort of stack the deck in your favor and have your dog not develop those problems. So dogs go through what's often called a sensitive period from about 4 to 14 weeks. And experiences during this time period will greatly affect their adult behavior. That's a time when they're sort of like little kids investigating everything. They develop social attachments and they learn signaling. And they also learn bite inhibition. That's learning to control the force of their bite or mouthing behavior. So if they, you don't want to overdo it, and, it should be positive and slow, but it's really important to be aware of that period of time that they have positive experiences and get exposed to things, because sometimes lack of experience can actually predispose them to problems as well. If they don't see other dogs or cats or different types of people or people with funny hats or umbrellas, they might not learn what those are, and they might be afraid of them later on. Unfortunately, we do often see dogs with a history of trauma during their sensitive period or early in their life, a dog that might be orphaned or severely sick. Of course, that doesn't happen to every dog, just like with people. Someone can have something very traumatic when they're young and overcome it. But also for some dogs, that could be something that makes it, more difficult for them later on. After the sensitive period, dogs then go through social maturity at about 8 to 24 months. That's the next most important time. And this is commonly when we see the emergence of behavior problems. Certainly there's outliers. There's dogs that I see with behavior problems from 8 weeks old or even younger. And some dogs that don't seem to develop a fear or anxiety until they're a little bit older. But that social maturity period is a very common time for behaviors to prevent. And that can kind of throw owners off because they think their puppy has been developing in a certain way, and then it just surprises them at 10 months. There's sort of a new behavior they've never seen before. And the last thing I wanted to talk about quickly in this category was breeds, because I'm often asked about like which breeds have the most problems. And I think that, we certainly treat all breeds for all problems. So even though genetics plays a role, it's more important what that dog's parents were like, not the breed in general. So you can find, examples of every type of behavior in every breed. I mean, there are exceptions with some more rare behavioral disorders, but dogs are very individual in that way. And there has been some genetic research recently that supports that as well. Another difficult topic that I don't know that I can do justice in this amount of time, but there is the question too of like, is this my fault? Am I anxious? Am I making my dog anxious? And this article kind of does support the idea that there's similarities between the personalities of dog owners and their pets, but I think it's a really difficult question. And I think we, first of all, don't need to judge anyone for anything that, they're feeling or their dog's feeling. I think that there's too much stigma around emotional disorders to begin with, but I think it's a really complex relationship to tease out. And I think that there's something called emotional contagion, and that occurs when someone's emotions and related behaviors lead to similar emotions and behaviors in another individual. And I think dogs are very keyed into our feelings, and so there may be like a feedback loop going on, but it's chicken and egg, right? Like it may not always be just the human or just the dog. For example, if your dog's frightened by another dog when it's on leash and barks and jumps and scares the owner, the next time they go out for a walk and the owner sees a dog at the end of the block, they might start to tense up on the leash, and then the dog thinks, oh, there's a problem, and then it kind of goes into a feedback loop. So I anecdotally, just in my experience, I feel like I see owners that are anxious that don't have anxious dogs and vice versa. So I think it's really difficult. I just don't want anyone to feel guilty because I don't think that that's going to help. So what can you do to help your dog if you think they're overly anxious or frightened? As I mentioned previously, seek help from your family veterinarian to diagnose or address any physical problems. Sometimes we tend to sort of write off behavioral problems as being entirely separate. And sometimes we just don't know. If we don't look, your dog might actually have something that can be addressed and actually fix the behavior. I'll talk on the next slide about some things you can do for general environmental management. Another common myth or misconception is whether or not it's okay to comfort your dog when they're anxious or frightened. And this is one thing that I think is pretty clear, that I think you're not going to worsen your pet's anxiety by helping to calm them. It's probably important not to act very distraught or frightened yourself. Like we talked about with emotional contagion, that might actually, that will may worsen your dog's behavior. But I think though there's sort of an outdated notion that if we give our dog treats in that moment, we're going to reward the behavior. And the reality is you can't really reward an emotion. So when we teach dogs to do things using treats, it's voluntary behavior that we're rewarding. And treats are only going to create more positive emotions. The dog's not going to continue to spiral and be more anxious because you're giving it treats. There's certain exceptions to that in the way that we order things. Like if you give it treats every time there's a storm in a certain order, they might think the treats predict the storm. But in general, I think it's really okay to be calm, be a source of a secure person for your pet to look to. And in that light as well, one thing I wanted to mention was avoiding punishment. I know it seems surprising that anyone would use punishment with an animal that's anxious or fearful, but it's actually pretty common. And I honestly think people are doing the best that they can with the information they have. And they may not know what else to do. And it may be that the behavior is problematic or frustrating for them. And talking about punishment in general gives me anxiety because there's so much misinformation and strong emotions that people have around it. So punishment is, it's hard to realize, but it's anything that serves to lessen a behavior. So anything that your pet doesn't like, that's aversive, that can decrease their behavior. So it could be everything from scolding, going all the way up to like putting on a pinch collar or a shock collar. And certainly punishment happens all the time. We all deal with punishment every day. It's sort of part of life, but I feel like in general, we don't need to add to it. And certainly, very aversive methods only serve to worsen your dog's fear, and they can really backfire and actually make the problem much, much worse. So when you know better, you do better. And then obviously too, I'll talk more about treatment specifically for behavior. And also, like Dr. Perry mentioned, tracking and monitoring is really important. It's really hard sometimes to keep track of actually what's going on, because we really only have your information to go on. So I really encourage people to look at the frequency of the behavior, how often it's happening, how long does it last, and how intense is it for your dog. So your dog may have one day when it's like a 10 out of 10, super intense, and another day 6 out of 10. And trying to track that over time just to see if things are getting better or worse. So just to elaborate on environmental management, and this is just sort of general recommendations for a variety of issues, but I think the most important things to provide any dog are space, choice, and mental and physical enrichment. And obviously this should be tailored to your individual dog's needs and preferences. Every dog's gonna be, different in their tolerance of different things, but space might mean providing buffers for your pet from stressors. Dogs always appreciate the ability to get away from something that they're scared of and a choice about who they interact with. So the dog here that's sitting on the other side of the baby gate might have a wonderful relationship with this child. But sometimes, a dog wants to rest and doesn't want a toddler climbing all over them, or the mother may not have time to adequately supervise their interactions. And so, it's a nice thing for your dog to get comfortable sitting on the other side of a gate with everything they need so that they can kind of be there and not be stressed. The dog on the blanket with the tether is somewhere where, they can't be contained, but they were given a high value, safe treat that they can sit and enjoy, and they're quite content to sit on that mat, and it kind of sets them up for success. For dogs that have issues with things they see out the window, of course, you can't completely remove the outside world, but window cling and things like that can really help with outside triggers. And as I already mentioned, like engaging your dog in enjoyable activities, letting them go on walks to sniff things, doing things that they enjoy, getting physical exercise or enrichment can be really helpful. Lastly, I just wanted to say a word about medication for behavior. Obviously, I'm not, whether or not that's appropriate for your pet is up to your veterinarian, but generally speaking, I think a lot of people are weary of medication since they worry it will change their dog's personality or subdue their behavior, or they think maybe medication is magic and it'll fix all their problems. And I think the truth lies somewhere in between. You know, when used appropriately, medications can decrease fear and anxiety and improve a dog's welfare. They're not going to change your dog's behavior overnight, but they can lessen their arousal and allow them to learn new, more relaxed behavior. So I wish I had a medication that had, like, turned off the bark button or, you know, made them want to, you know, do certain things, but unfortunately it just doesn't work that way. Medication is always going to work best when it's combined with a comprehensive behavioral treatment plan, because you need that for their brain to start to make new connections. But I also think, in my experience, that medication could be extremely helpful for some dogs, especially for phobias, severe thunderstorm phobia. There's some really good options for medication. And lastly, just to back up what Dr. Perry mentioned, you know, you can seek help from your primary care veterinarian. There are unfortunately not that many veterinary behaviorists. We're working on creating more in the US. But there are options for your primary care vet to do a vet-to-vet consult with a veterinary behaviorist. And sometimes, if it's appropriate, your vet can tell you if working with a qualified trainer would be best. I wouldn't start with that necessarily, especially for more severe fears and phobias. There are wonderful, wonderful trainers that are very skilled at working with dogs with separation anxiety and other types of fears and phobias, but unfortunately, training is not a regulated industry. So I would definitely defer to a professional in terms of which type of care would be most appropriate for your pet. And just some resources, I can send some more. I did put together like a reading list, and there's some veterinary behaviorists in the New York City area that I was going to send Michelle, but these are some of related resources for Cornell and the American College of Veterinary Behaviorists. And I think that's it.
Okay, wonderful. Thank you so much. This was fantastic. Very, very thorough. If you want to unshare your screen, we will get to some questions. We have a bunch. And just to let everyone know, along with sending the link to the recording of tonight's event, we will send the resources. So a list of resources, both reading material and just any recommendation for veterinary behaviorists. Okay, so let's get to some of these. We had one about let's see, in a foster home. This is about cats, but probably applies to dogs too. What are the best ways of doing cat enrichment when, I guess, space is limited? We usually separate foster cats from each other, and sometimes they're in very small spaces. So this is a rescue group and a foster home. So when challenged with space.
Oh, that's a good question, because obviously you're limited in what you can do, but providing, I'm getting comment from my kitty in the background, providing hiding areas, you know, the research shows just providing a cardboard box if the cats are in cages can really help them if they have a place where they can hide, and you know, especially because most of the times when they're in these situations, they are stressed. But if it's in for instance, a small home, then, you know, anything like an interactive toy, even the faked little fuzzy mice that you have, catnip, anything like that, cat grass, playing videos, certainly giving them any vertical space if there's any of that. We live on 2 dimensions, but cats really like to use the 3rd dimension. So I really encourage using vertical space, because, you know, there's a lot going that way that we can give them access to. And depending on the cat, sometimes just interacting with a human, it can be enriching for them. So depending on the individual and their personality, you can usually find something that entertains them and keeps them engaged. But certainly, you know, toys and, you know, anything from giving them a snuffle mat where they have to search for food and a little fuzzy mat, or cat grass, or vertical space, or a hiding area would be really good.
Wonderful. We had a few questions about surgery and how that impacts this dog specifically. My very anxious dog is having surgery in a few weeks. Any recommendations to help her keep her calm through healing? We also had a question about a dog being spayed and that they're worried that that will, cause trauma. So just any thoughts on that, on surgery and the impact?
I guess that could be a whole talk in itself, like the post surgeries, like confinement and all of that. I haven't used it myself, but I know that one veterinary behaviorist in California recommends Sue Garrett's crate games, I think it's called, for crate training dogs who need to be strictly rested. Obviously, like enrichment and like giving them their meals and frozen Kongs, and then also really working with your veterinarian to find that's a time when I think use of short-acting medications, like finding what works best for your pet to decrease their stress, not to just zonk them and turn them into a zombie, but just help limit some of that anxiety. I don't know if I'm answering their question enough, but that's sort of the gist of what. And if your dog, it really helps if your dog's already crate trained. I think it's really hard when we have a dog that has to have surgery and be rested that really is anxious in a crate. That can be even more challenging.
Okay, great. No, I think that answered it. See, what's once you put a dog on medication for phobia, in our case noise, is it for life?
Oh, that's a good question. It's very individual. I would say that if they're on a medication, a daily medication, so something they're taking consistently every day instead of just as needed for a storm or something like that, they're not quick acting. So in my professional experience, I usually plan to at least have them on those medications for up to a year. But then we reevaluate and see how things are going. I think it doesn't, just because you start medication doesn't necessarily mean you're signing your dog up for medication for the rest of their life. You can certainly look at slowly weaning off of those once your dog is doing better, just like for people. Often for me, when we decide to continue the medication, it's a positive thing. It means that dog is doing really well, and we don't want to change that at that point. Although I do have situations where we are able to get them off medication, but I try not to start out with that goal, because I think sometimes then it just makes us all anxious. I don't want to give a dog medication if they don't need it, but I also want to give them the full benefit of treatment. Okay,
great. We have a question about Adaptil. We also had a question about CBD. If you feel like those can be helpful.
Yeah, in my experience, pheromones, the feel away for cats is maybe a little more helpful than for Adaptil, than for dogs, but I certainly have anecdotal reports of where it's really seemed to help. So and it's certainly not harmful unless your animal seems to have some kind of adverse reaction to it. I wouldn't spray it directly in their face. It's an alcohol carrier. So you just want to make sure if you're using the spray that you spray it and let it sit for 15 minutes. And I remember one dog actually that just seemed to really not like the smell of it, so we avoided it. But CBD is challenging. We're a little better than we were a few years ago. It's kind of like the Wild West. We don't have as much information as we need about it. At least now we can legally talk about it more. I will say that there have been a couple of studies looking specifically at fear that weren't necessarily encouraging, but it's an important. I think eventually we may figure something out. It's just, unfortunately, I don't generally recommend it because I don't feel comfortable that it actually will help at this point.
Okay.
With the products that are available.
Okay. I have a question because Dr. Anderson gave a presentation. You were here with us 2 years ago, right at the height of the pandemic, and it was more about separation anxiety. Did you see that? Are you seeing that? And what did we see in terms of, and now people maybe going back to work just curious about that.
I think everything has gone up, in my opinion. I don't know that I've seen I don't know, Dr. Perry, you can chime in too, because your caseload's a little different from mine. I certainly still treat separation anxiety. I do feel like in the post-COVID world, people have a lot more flexibility. So they're able to, previously, no one would ever be able to work from home or manage their schedule for their dog. So we were really like, this treatment has to work. You have to leave 8 hours every day. Whereas I feel like now people are able to kind of maybe not stave off the problem. Oh, sorry. But there's more flexibility. So we have a little more time to try to figure things out. I guess it's a mixture, but I feel like there's been a huge increase in need for behavior services in general, not just separation anxiety. Do you agree, Dr. Perry?
Yeah, I do. And I agree that return to work post-COVID has been a little bit more gradual. So I think that's helped a lot of these dogs cope with the change in schedule. The clients that I have treated that had separation anxiety before the owners returned to work made a really good effort to kind of minimize that transition and, starting early on to set the dog up to be home alone. So because we made such a big deal out of it, I think, and because the return to work has been more gradual, then suddenly, we first the shutdown had everybody stayed home. It wasn't like all of a sudden everybody went back to work. So I think that did help. But yes, in general, we've been seeing a lot more behavioral problems in general, at least I think because owners are home more, they're recognizing it and saying that, okay, maybe we should address this.
What I have seen more of that I didn't expect, well, I guess I thought about it, was puppies that were born during the pandemic that didn't have as much exposure to things during that socialization period, possibly
Yes.
having, and I don't know that it's because they're home and they can pay more attention to the problem. That's the hard part of our job, is that we don't go out and look for dogs with problems. It's really up to the owner to decide this warrants treatment, or it's there has to be a reason that they bring the dog in, so or the cat, so it's hard to say.
Okay, yeah, understandable. Okay, we have a couple of questions. My cat from age 6 months has always been excessive obsessive groomer. Is this a behavior they should be concerned with? Some cats naturally groom more than others.
Yeah, cats spend a lot of time grooming. They're very
Yeah.
fastidious, and some cats groom more than others. So if the cat has always been an avid groomer and isn't removing hair, we don't have bald patches or causing any lesions on the skin, then it just may be normal within that cat's behavior. If the cat starts grooming when it's stressed more, and we're starting to see pulling out hair, and some cats can really make themselves quite bald very quickly when they're stressed, then yes, then maybe we should address that. But in general, cats are really good at grooming, and if they just like to groom and they're keeping their coat clean, but they're not removing a lot of hair and not doing in response to stressors, then that's probably within that cat's normal range of behavior.
But I would just add that I would probably rule out allergies, because there have been studies that we tend to think like over grooming is anxiety, and there was a good study a while back that showed that it's more often maybe an environmental or food allergy, so it's important to rule that out too.
Yeah, anything that involves the skin, grooming could be due to pruritus, due to being itchy, and certainly addressing the physical is important. But most of these cases, a lot of them are treated by the dermatologist, and they resolved once they treat the dermatological issue.
Okay, great. Any thoughts on music, the role of music in helping stress?
Yeah, actually, there have been some studies in shelter dogs in particular that show that playing classical music can actually promote more relaxed, quieter behavior in shelter dogs. So I think they showed that you want to avoid any heavy metal, anything, loud rock or anything like that. But a lot of times that nice soothing background music, even if the music itself isn't soothing to the animal, if they are sensitive to noises, it can kind of help drown out some of the environmental sounds that normally would stress them out.
Okay.
There's through a dog's ear and through a cat's ear, I think, is a specific music for pets.
Yes.
Great. I know it's very helpful for my dog, I've found too. We have some questions about just older. It's an older dog, a 13-year-old that now is showing signs of never used to, and now is showing signs of anxiety, barks a lot. And I know you mentioned that can increase as they get older. So just if you could talk a little bit more about that.
Yeah, so it's hard to say what specifically is going on with that dog without more information, but anytime it's a dog over 8, 9, 10 years old, I do worry about like, and there's worsening anxiety. It could be, anxiety that's like progressed throughout their life and is getting worse. We do also worry about cognitive decline. Dogs do get a very similar form of dementia that's like Alzheimer's, and unfortunately there is no specific way to diagnose it. It's what we call a diagnosis of exclusion. So we have to kind of rule out all the other reasons. And obviously an older dog is more likely to have multiple physical problems along with that. But usually it can be, we can improve quality of life by addressing pain and treating the specific anxieties. There are some questionnaires you can fill out that might say whether or not cognitive decline might be what's going on, because we do see changes in social interactions, house training, and anxieties, and there's a whole list that you can go through.
Okay, and I'm sorry, I just found the question again about the 13-year-old dog. She has lost her hearing and has cataracts in both eyes. Could that be part of what's going on?
Yeah, I think we don't really know, but some people theorize that when they lose their hearing, but then they do sense something, they have like a more of a startle response to it. And obviously when their sensory experience is changing too, they may be more anxious about, where they're going or what they're doing. So I think we always say that age is not a disease. Obviously, we want to rule out actual diseases and treat those, but as we age, we do have changes that can affect our ability to function like that.
Okay, great. And I know we did talk about this during the separation anxiety lecture, but just do you feel changing your routine prior to leaving your home can be helpful to de-stress the departures?
Oh, you mean like doing like low-key departures?
They're saying, just so that they don't, know that you're leaving, get to you pick up your keys and that type of thing, put on your shoes. So maybe just vary your routine, I think is.
Yeah, it's interesting. I think I've seen different things happen with different dogs, which is frustrating. I wish I could tell everyone do X, Y, and Z and it will be great. But I feel like sometimes dogs want predictable departures and some dogs get more anxious with predictable departures. If it's at all feasible for a dog, I try to pair a departure with something they enjoy, like treats and a snuffle mat or frozen conchs. But for some dogs, that doesn't work at all. But I think some of the behavior modifications that are still being used, actually, like they call it uncoupling the cues, where you like grab your keys and then you don't leave, so your dog stops watching kind of what you're doing. I feel like that can actually backfire in many cases because they just start to watch you all the time, and we're not nearly as good as our dogs. Like they've spent all their time watching our body language, and so they know if we're leaving to get the mail, or if we're leaving for a week, or if we'll be back in and out. Like they just can kind of sense by our behavior what we're doing. So, but I do find that just sort of making departures sort of a non-event and calmly and leave something for them if you can is generally helps in most cases.
I feel like they're on to us now. Now they've right. Yeah. We have a question. I'd like to know why my dog growls when I pick him up when he's relaxing on the couch, even after he just sat on my lap. Hard to know, but yeah.
So I guess depending on the dog, that could be painful for them. A lot of dogs don't like being picked up, or they could feel uncomfortable. We do tend to do that, especially with smaller dogs, like that we feel like, we can, on cats too, we can just scoop them up. But that's like petting, like I was talking about petting and hugging and kissing, picking up is another common trigger. Some dogs they don't like that feeling. And so they are trying to tell you, I'm not really comfortable with this, even though it seems counter to what they were sitting on our lap, like surely that's how they want to interact, but that they're trying to communicate. So I would, if you want to work with someone, a professional, to like help you desensitize them to being picked up. But often I say to people, let's just avoid picking them up unless we really have to.
Okay. We also had a question about a dog that gets aggressive and seems anxious at the groomers. So do you find that is, don't go to the groomer.
No, so there is a whole area of training for grooming and vet care called cooperative care. We, over the years, I think vets are doing a better job. We still have a lot of work to do, and groomers too, like in terms of low stress handling and making these things enjoyable. I think Many dogs tolerate those procedures really well, but for many dogs, that's very, very stressful, having people like touching their feet, cutting their nails. Some dogs find brushing to be, and cats find brushing to be a positive thing. Like they actually see that as a, a treat and enjoyment. But for some dogs, it's scary. So yeah, there are wonderful resources and whole books now on how to, slowly get your dog used to handling and things like that. Certainly, if there's aggression involved, like if they've bitten the groomer, then we'll work on, muzzle training and other things as well, like a basket muzzle that they can comfortably wear. But if you Google cooperative care, there's a lot of different resources out there.
Okay, wonderful. And as I mentioned, we will compile a list and send this to everyone tomorrow, along with the link to the recording. Well, thank you both so much. It's extremely thorough and helpful presentation. We so appreciate you taking the time to be with us. Thank you, Kimberly, for doing such a wonderful job organizing our events. Just again, a reminder, we will send the link tomorrow afternoon. And that our next lecture, Heart Disease in Pets as They Age, will be held on Wednesday, May 24th at 6 p.m. Okay, thank you again, Dr. Anderson and Dr. Perry, for sharing all of your knowledge with us, or some of your knowledge, but we really, really appreciate it. And a very special thanks to all of you for logging on and spending part of your evening with us. Good night, everyone.
Thanks
Take care.
for having us.
Thank
Bye.
you.
Good night. Thank you.
Bye-bye.